Boothby Therapy can be whatever you want it to be. I spoke with some women that have children or are thinking about having children or already have kids in college. It can be a part-time show, it could be full-time, it could just be clinician on call, it could be just doing evaluations if that's what you want to do.
I was hoping to have this, nice variety of caseload, and it was a great match. It worked very well for what I was looking for in the schools and the kids and the caseload and the ages, and Boothby Therapy Services meeting my needs.
Well, my initial thought in seeking a new challenge was that I had been in schools for 13 years, first in Massachusetts for several years and then in New Hampshire, and I never felt very supported by administration. And that was one of the driving forces in leaving, actually, is I wanted to work in an environment where the individuals I worked for knew intimately what I was doing and supported what I was doing. And I didn't feel that I had that as much in a public school.
Initially, Maren Boothby was my clinical manager, and she pretty much held my hand for the first couple weeks and accompanied me along with Christopher Boothby to the interviews at the schools, helped me, formulate lists of questions so that I could interview the people who wanted to interview me, and pretty much just told me it was my call. If I wasn't getting a good feeling about the environment, then that was not a good place for me to be. So there was never any pressure to take something just because it was there. Maren and also Danielle, my other clinical manager, they have done multiple in-services on updated test instruments, how to interpret data, how to write a good evaluation, how to assess appropriately, and those were all things that I had kind of not done since graduate school. So I needed that support and that encouragement to be able to learn that again.
Having a clinical manager made a huge difference, that I had somebody to call, kind of those panic therapy moments where you just say, I'm not sure what to do here, or an administrator has a question for you that you're just not sure of. There's somebody there to access, and also I feel as though the clinical manager opens you up to all the therapists that are in Boothby. They know who has a specialty in AAC or who knows a lot about stuttering, so you can call those people and then ask them the questions that you have. It just gives you access to so much information that just going to a website doesn't give you, or just kind of surfing the web or looking in your old textbooks just doesn't give you as much as somebody who's been in therapy and has access to those therapists do.
The clinical manager is 100% overhead. And that's something that's important, because if we didn't value the mentoring, the guidance, the support that the clinical manager provides to our therapists, that wouldn't be a wise investment. To the contrary, I believe that one of the best investments we make in this company is our clinical managers, because they do nurture, guide, mentor therapists. They build a personal relationship with a therapist that is actually meaningful to both of them. And in doing so, the level of therapy that we're able to offer to schools and to children is dramatically different than they were able to before they had such a mentor, such a guide. You shouldn't join Boothby Therapy Services if you're not willing to be excellent, if you're not willing to truly examine your own goals and aspirations and work to meet them. Now, if you are willing to take that challenge, there's no better place, there's no better company in this country to work for than Boothby Therapy Services.